Hey, welcome back to the KRUSE Elite Podcast. What's up, Tony?
Good morning, Taylor. Happy Friday to you.
Yeah, happy Friday. I always like actually recording with you on Fridays because I don't have a lot planned on Friday other than this, so everything's kind of built around this. And then when we're done, it feels like I accomplished something.
Yeah,
and then it's into the weekend.
I think you did. It's interesting because I think for you, perhaps, and let me know if this is wrong. Once you're done recording, the work is kind of done on the episode.
Yeah, thank goodness because of you. Thank goodness, because people don't realize the type of like work and editing that goes into something like this. If I had to do it, it wouldn't get done. You know,
it takes a lot, and I mean,
it does.
You guys produce so much content on social media and on YouTube and whatnot. And I was just thinking myself, like, man, that's just a massive amount of time. I can tell, like, for a short video where you're showing off like a visual drill or something.
Yeah, it's like the back end stuff
and making sure you got a good shot. And yeah,
it's forced me to become pretty good at one take. You know, like early on when I first started creating content, oh my gosh, it was a disaster.
Yeah.
I mean, you care about all the things that don't matter, you know, and it's like, it's very hard to learn how to get, for most people, it's very hard to learn how to get in front of a camera. And then I always had a hang up for a long time. It's like, okay, who am I speaking to? Because I could get in a room with, 10, 20 people and run a class, whatever, teach exercise, educate, and be comfortable. But then when I switched over to content creation, man, it was bizarre. I was like, didn't have the same feeling, and it was hard, and I cared about all the things that didn't matter. But, over the years, you start to figure out, what does matter and what doesn't. And you get better at it. You get better at it. And then I've sort of just kind of developed the skill of being kind of a one-take guy most of the time. So luckily, as far as like editing goes, it never gets too bad because, a couple jump cuts here and there, take something out. Yeah, but that's the secret for my content creation, is because, we don't outsource any of that. You're the only person on our team, other than Alicia and I. So yeah, it's got to be a one take.
Yeah, no, I've been there where you just have piles of footage and you're trying to condense it down to something small, and it's
totally
way more overwhelming than the length of the piece would seem to indicate.
Yeah, I don't have that skill set. I mean, I could piece something together, but what would happen is it just wouldn't flow the way that I ultimately would want it to, and it's just almost better for me to do like one take and then go with it, Yeah, so it's the back end stuff can be tough, even just one take. I mean, getting the files and all the back end stuff with the editing and publishing, and
that's a whole world.
It's a whole boy, does it take a lot of time. People just think like me when Alicia and I started transitioning our business to being online. I was like, yeah, I'm just gonna set up the camera and do what I do, and I didn't realize, oh gosh, this was a career change. Yeah. That's what it was. Yeah. It was an 100% career change. And that was not clear to me at the beginning, and a difficult process to, work through.
Yeah.
Yeah.
But no, I mean, I've seen it even in the short time we've been working together. I've seen the quality increase.
Cool.
Like
Thank
reels
you.
And the stuff, and it's just looking sharp, and
nice.
I think it's awesome, man.
Yeah, we're definitely like we're greasing the groove now, is how I, how I sort of feel and think about it. Whereas before, several years back, we were still sort of like, what should we be doing, and doing a lot of experimentation, and you have to go through that process. But as soon as you get grounded enough and clear enough on what your offerings are and what you're doing and who your target audience is, you just grease the groove and you just keep going.
You said, you're focusing on all the wrong things.
Yeah.
Do you have any examples of what that might be?
As far as getting in front of the camera?
Yeah.
Oh, yeah. So like, so some of them are production quality, right? Because in order to be in this kind of a online business, and I struggle to even call myself a content creator because even that's not what I am. I am just an educator and a coach. I just happen to record it. And the quality is not amazing, and it never will be as long as I'm in charge of it. It'll just be good enough, right? And when you first start doing this, you care about all the things that don't matter, like what you're wearing, how you look, how you sound. You're really concerned about how like people are going to perceive you, and it distracts you from doing what you do best, right? And so when you're distracted like that, it challenges your delivery in the content. It makes you make mistakes that you probably shouldn't have made. It makes you second guess something you said and then want to redo it. And then before you know it, you're filming over and over and over again. And then the repetition starts getting you out of flow state,
Right.
And it can become a frustrating process. I mean, I remember getting hung up on things like, I don't have a good enough camera. The lighting's not good enough. I said something that wasn't perfect. I stuttered. We have to reshoot. Those types of things just absolutely crush your creation of, your content. And it just takes a while to get through that part, that piece. And once you do, and you stop caring about those things, and you start realizing that your target audience who actually cares what you have to offer and say, they don't actually care about the production quality like you think they do. They just don't, right? It's more about being authentic, showing them you're a real person. If you make a mistake, it's okay. The quality of the production doesn't have to be like, studio, team doing it. It's and you just learn all that little by little.
Yeah. That's really sage wisdom. And I have a feeling some of the people like in your courses might be trying to do something similar. They might be coaches, or they might be educators, and they might be trying to get online. So
yeah, for sure.
Someone can take that to heart that's getting started, and they can
I
just
hope
get
so.
going,
Exactly. Just get going and do it.
Well, today we've got another Q&A, our second Q&A episode.
Yep.
I'm curious, did you get much feedback from the first one? I think it might have just dropped.
It just dropped. Yeah, I don't think I've had an opportunity to get much feedback yet. But I'm looking forward to see how people are enjoying it.
Yeah. Well, if you're listening at home and you have any feedback for us, by all means, reach out to Taylor and let him know what you're thinking. So I'm just going to grab a question and we'll get started.
Let's do it.
This is from Linz Jenkin. How do the vestibular and visual systems get out of whack in the first instance?
Right. Yeah, this is I remember this question actually, or this person had put this in one of my other question. It was maybe in a comment, and I said, "Hey, you hold on to that one, and we'll nice. Get that one into the podcast." So I'm glad that one made it through. So, how do vision and vestibular deficits happen? Is basically right. Like, how do they manifest? So there's lots of layers to this. You can be born with vision and vestibular deficits. It's a possibility for sure. And there's probably so many factors to that I really can't even speak on. I don't know them all, but know that it's possible, right? And it doesn't mean you can't work with those systems. Just if you're born with an issue, born with a vision issue, doesn't mean you can't work with it. Born with a vestibular issue, doesn't mean you can't work with it and train it. That's for sure. But for the general population, individuals who develop this kind of an issue, there is definitely lots of factors to this. So one of the more common ones is head trauma. So if you have a concussion, or like a whiplash injury, you can basically your vision and vestibular systems are affected by that through the injury and then sort of the aftermath of the injury and how you become highly sensitive to different forms of stimuli. So after people have had a concussion, they'll report being sensitive to visual input, sensitive to vestibular input, sensitive to sound. And all of that really raises your sympathetic levels, right? As you're getting through that part, and your brain and your body compensates like it does and as well as it can. And it's like your calibration for your eyes and your inner ear can be off, right? And then if that's not restored, then you go on, to eventually hopefully recover from the concussion, but you might be left with some kind of deficits in your vision and vestibular systems. So that's fairly common after head trauma, which is why both vision and vestibular exercises really need to be a part of concussion rehabilitation. And remember, a lot of people have had concussions and they don't know it, or they didn't think it was a concussion because they weren't knocked unconscious. But that doesn't mean you didn't have a concussion. So you can even have, these issues going on, even if you didn't have a diagnosed concussion, if you know what I mean. So that's one possibility that's somewhat common. And, you can also develop vision and vestibular issues through disuse.
Right.
Right. So, and it's common, right? So examples would be, sitting at a computer for 9 hours a day, staring at a computer screen. Your eyes are essentially locked into convergence. So you've got muscles that pull your eyes inward to help you focus on things that are in front of you, like the computer screen. And if you're in a seated position, staring at a screen for 9 hours a day, 5 days a week or more, well, that's a lot of time to spend in one position with your eyes and your whole body for that matter. And you can develop imbalance in your eye muscles, just like you would possibly develop an imbalance if you were doing asymmetric types of movement and you didn't know about it, right? Like a postural imbalance, or you had an injury and you didn't move the way you used to and you developed muscle imbalances in your body. Same thing can happen in your eyes. So that's one example. It doesn't have to be just 9 hours a day staring at a screen. It can be other kinds of tasks too that cause changes in your vision. But a lot of them are based on the idea of doing the same thing over and over and over again. The vestibular system can become deconditioned from a lack of activation. Okay, so kind of a more extreme, relatable way or example would be as a person ages, if you've experienced watching a person age into their 70s, 80s, and beyond, you generally see a very significant change in their posture. They start to have a more flexed posture. They start to be more concerned with looking at the ground rather than looking at anything around them. And part of the aging process that you're seeing there is decreased sensory input coming in from the eyes and the inner ears because the person's not moving the same way that they used to. Therefore, they're not getting the same amount of activation that they used to. And the physical consequences to the vestibular system not being as active as it needs to be is a loss of extensor tone. And that's because that's what the vestibular system does for us primarily, is it helps us maintain appropriate muscle tone in our anti-gravity muscles that help us stay upright against gravity. Mm-hmm. So when the inner ear is not receiving appropriate input, one of the consequences to that might be a loss of extensor tone. And the eyes in the inner ear are not completely separate. They work together. You can have, different other things going on too, decreases in peripheral vision. And there's so many different names of vision conditions, but they all have the they all have consequences to them if not resolved, right? And so, yeah, disuse, overuse, head injury, and honestly, even like some of the ones that go under the radar, like nutritional issues.
Sure.
Nutritional issues and just being under high amounts of stress for long periods of time. All that can affect you neurologically and play into some of the deficits that we might see. And here's the thing. Most of the people that I'm working with, and probably even most of the clients that our students are working with, have low grade vestibular problems. So, meaning if they go to a vestibular clinic, they're not going to be told they have an issue.
Mm-hmm.
Right. So, this is like low grade stuff. And you can have low grade type vision issues, vestibular issues. I guess the point I'm trying to make is it doesn't have to be extreme. Like most of the time when I'm testing people, you'll find these little things in the vision and vestibular systems, and it makes me ask questions. It's like, well, how did this manifest? And there's so much that goes into it. With how a person's moving or not moving,
mm-hmm.
and it's a result of all of those things.
Yeah. You mentioned stress.
Yeah.
And I think maybe this can go in the same bucket, but also like environmental factors, like you talked about mold and stuff, and other things. So like,
mold's a big one.
Those are stressors on the body, right?
Absolutely. When I was at peak mold toxicity, I had decreased contrast sensitivity in my vision. Also, I became sound sensitive. Two things that were like all of a sudden I was like, what is going on?
Yeah.
And I remember it being pretty like it felt like it had just showed up. It probably was building, and I wasn't aware of it until I was like, whoa. But yeah, I mean that's just an example of stress on top of stress on top of stress, and then that affecting me neurologically. And when your sympathetics become elevated for a long period of time, what can happen is your body can start interpreting normal signaling as dangerous.
Right.
It's a survival mechanism. And so then you start having symptoms from all sorts of things, even if they're not necessarily dangerous things. Yeah, there's more to it with mold for sure. I mean, the mold's attacking your body, so it's deeper than that, but that's what happens on a sensory level.
Yeah. And then the last bucket, which maybe is a form of stress in a similar way, but just, actual disease, right? And that's not something that we really cover so much here, right? But I'm assuming that there's neurological disease and there's
absolutely
other things that would affect the vestibulars or inflammation in the brain, right?
No, absolutely. All that stuff can absolutely affect those systems, no question.
Yeah. When I'm editing podcasts and it's been a long time, like I notice part of it's because I'm listening really hard, but I think part of it's this convergence thing is my eyes just kind of glaze over when I'm looking at the waveforms. So it's like I have to see them enough to know where to make my cuts, but I don't have to like really get the detail. And so I notice they'll like come in and out of focus. And I wonder if that's either like a sign of a deficiency or if it's like my brain's way of being like, stop focusing on exactly 4 feet in front of you for a little bit, Yeah,
well, it's hard to know, but sometimes when you're doing some kind of task like that where it takes a lot of concentration and you're watching something, you'll actually shift in and out of, you'll kind of dilate your gaze and shift in and out of using like foveal vision, which is, what's right in front of you, and actually bringing peripheral vision into it. And you shift in and out of that because your peripheral system is designed to pick up movement better than your foveal system.
Interesting.
And so as a skill set, you might have developed this actually, because this is what we teach our students to do during gait assessment. It's really the skill of finding the negative space. So like with gait assessment, when we're watching a person walk, there's so much going on with gait that you could get distracted by lots of different biomechanical things. But if you learn how to essentially stare through the person as they're walking and go in and out, there's moments where you're looking directly at their hip or maybe directly at their shoulder or their foot or whatever you want to concentrate on. And then you sort of shift your gaze and dilate out into the peripheral system where now you're just picking up negative space. The peripheral system is excellent for seeing movement happen. So
That's
you can,
so cool.
so this is the people who are best at gait assessment do this versus just look at the right leg, because then you miss everything else. So I actually wonder if you are sort of doing some of that and sort of picking up on the negative space and using your peripheral system almost to kind of keep track of the waveforms that are coming.
I think that's right, because they're moving, to the left across the screen, and usually my cuts are in the negative space between the blocks of speech, essentially, right?
Yep. And it can be fatiguing, especially if you have to do it for a long time.
I have to take breaks. I can't sit there for 5 hours. Like, I have to take pretty frequent breaks.
Yep, yeah. Sure. Yeah, that's interesting.
That's really interesting. I never thought it would be a skill, I guess.
It's
I
literally
kind of assumed it was a problem.
it is. Yeah, it is literally. If that is what we're talking about, it is literally the ultimate skill to have as a coach who is analyzing movement.
That's fascinating. All right, next question. This is from 2018 S. Ben. Best way to stimulate the vagus nerve to help bring the nervous system to a parasympathetic state.
We have a whole episode, Ben.
That's true.
Yeah. We have a whole episode, so you can hit that up. Yeah. Yes. It's literally on the vagus nerve and in vagus nerve stimulation, titled something like what you really have to know about the vagus nerve. Yeah, I refer a lot of people to that one. So there's definitely that episode if people want to check that out. But best ways to stimulate the vagus nerve to elicit more of a parasympathetic state. So yeah, there's a lot of options. I guess before we even get into those options, one thing that I want to say about stimulating the vagus nerve is that it takes a heck of a lot more frequency, load, and intensity than people understand. This is the gray area right now because there's a lot of conversation in the industry across different spaces, different kind of neuro spaces. There's people using vagus nerve activation for lots of different reasons. A lot of talk about it being good for stimulating parasympathetics so that we can have that down regulatory effect. And the talk is there right now. The application is not. When I see this stuff on social media, and you see a lot of people saying, "Here, try this drill for vagus nerve stimulation." Basically, what you're seeing is the activation of the vagus nerve in a fairly isolated way with certain things that you can do. But really, all you can expect from that is a fairly temporary result, if you get a result at all. You do have to assess to see if you're getting a result. But some of the tools are great, and you just have to know that most people don't understand how much work you have to do to elicit the changes that we're looking for when it comes to creating a significant enough, shift in state. Right? You will get immediate changes that cause different reactions in the body that will give you a clue that you're doing the right thing. So sometimes you'll do a drill, you'll start to yawn, or you'll have a decrease in tension in your body, an increase in range of motion. Sometimes after a vagal type drill, you'll notice that your voice is deeper, which is really common, or that your stomach starts to growl. Those are all indications that you're getting a vagal type response from an exercise. So is there a best way? No, there's no best way because it's so individual and we do have to test it. So there's a lot of ways. And then the question is, which ones are working for you the most? So a couple of suggestions would be exhalation-based breathing drills are typically parasympathetic in nature. Now, they're not good for everybody. Like, I want to keep stressing that because there's different reasons why certain people don't do well with exhalation-based breathing drills. So again, we have to test. But generally speaking, if the exhale is 2 to 3 times longer than the inhale, that's what I'm talking about as far as exhalation-based. Mm-hmm. And that can create a nice shift. So that's kind of one idea. And we have a lot of different breathing drills that we teach. I particularly like the diaphragm stretch that you can find within our content, like over on YouTube and stuff. That one can be very vagal in nature because it's a exhalation-based exercise, but it also is useful because of the type of mobilization that occurs during the forced exhalation. You get some stretching that happens in the abdomen and around the diaphragm, mm-hmm. which is also usually a parasympathetic in nature because it's activating C fibers, which is a nerve receptor that is basically going to send information to the vagus. Okay, so that's one idea. Exhalation-based breathing drills, and then check out our diaphragm stretch. Hands-on work is excellent for vagus work too. And that doesn't have to be someone else's hands. It can be a trained professional. It also can be, you can use different tools on your body to do tissue work. And the piece that is probably most important if you're going to do that is that you don't have to work crazy deep. So it can be, dermal level stuff, particularly, this is the key, on the trunk, like the abdomen and thorax, not the arms and legs. This is important. Not the arms and legs. The trunk and the thorax is going to provide more of a vagal response or a parasympathetic response. And again, it has to do with C fibers, that nerve ending being more abundant in the midline of the body, abdomen and thorax. So that's a good thing to know if you're doing like hands-on type work. Beyond that, another really interesting one that you'll hear about when you listen to the podcast is electrical stimulation of the vagus point on the ear.
Okay? This one always trips me out.
Yeah. Now this one's interesting. A lot of research on this one is coming out, and it's good. Like there's a lot of good conversation happening now, and a lot of companies building vagus nerve e-stim devices that go to the ear. And there's still a lot to learn here. It's not magic. You don't hook one of these things up to you and have this euphoric experience. It's not. It's like you do it and you're like, I wonder if this is helping me. And then typically what you see is like over some time of consistently using it, you might start to see some markers shift for you. That's been my experience anyway, having had clients use these things pretty consistently. I've even, had people kind of report improvements in like their HRV scores, but, feeling more relaxed, stuff like that. It's not a tidal wave type of change, right? But it's interesting because a lot of the research is pointing to it being useful for decreasing inflammation, which makes sense because the vagus nerve is tied to basically our anti-inflammatory pathways. There's been some research on it being quite useful for inflammation markers in individuals with arthritis, right? And it's cool because I think in the study, they only did like 2 or 3 minutes a day. It might have been like 2 or 3 minutes of stimulation twice a day, something like that. Mm-hmm. And I've played around with different electrical devices, but then also just vibration on the ear in that point. It's called the Simba concha of the ear. So you can just look up the ear anatomy. It's not hard to find. Anybody can find it. And then, you just put some sort of sensory stimulation on it and see if it helps you, see if you notice. It's an interesting one. I've even taken like Tiger Balm, which is, that gel. It's like a muscle rub, basically, mm-hmm. that goes back and forth. It's chemoreception, right? It's chemical sensory stimulus that goes like, it feels like warm, cool, warm, cool,
it's
warm,
like
cool.
Icy hot.
Yeah, exactly. You could use something like that. And I've put that on my ears too in that area. And I had a good response with a client with that before, and it's so easy to do, and you get low grade vagal stimulation for hours by doing that, which is sometimes the key, right? For people
almost
that
like
really need
kinesio
that
tape or something.
Yeah, kinesio tape, I haven't, you can't really do that. I mean, you might be able to use kinesio tape on the back of the ear and get somewhere with it.
Sure, I just mean in terms of like
Yeah,
it being something
exactly. You
that
wear
can
for
work
hours.
on you. Yeah.
Exactly. It's a passive stimulus that now you can just go about your day and receive that stimulus. That can be very important for people that really need the work long term, right? Yeah, so those are really good ones. And so we've got the breathing, the exhalation based breathing. We've got the stim on the ear through the auricular point, and let's not forget about like basic strength training, right?
Sure.
Because the contraction of muscles and the stretching of tissues, particularly like the type of stretch that you might feel at end range of motion through like connective tissues and stuff, is also a very strong C fiber stimulus. So sometimes even different forms of strength training can be a good stimulus for the vagus.
Yeah, that's cool to hear.
Oh, and let me just add real quick, because I'll kick myself if I don't add this one. You can also use things like humming and gargling water, and in those the motor activity involved with those actions is also stimulating for the vagus nerve, as well as different things that you can do like exercises with the tongue. Those are also quite vagal. So yeah, I'll teach tongue exercises on Instagram. You'll see me gargling water. That's why, right? We're doing more of a, going after more of the actual motor components involved, like in the throat, in palate area, to stimulate the vagus nerve. So sometimes that's something you can lean on. We like to stack that with other forms of vagus stimulus or doing other exercises to make it a stronger input. But those are very valid and quite good. So
yeah, I was literally going to say one of the ones that seems to work for me, or at least that I enjoy, is like that humming, like kind of deep humming.
For sure.
And when you do it, you get like this vibration in your throat and in your diaphragm. And I was going to say singing as well, like kind of deeper diaphragmatic singing. I think there's a reason why people connect with it, not just for the music, but for that kind of stimulus. And then of course my meditation practice has like been really inconsistent. But when I'm doing it, like if I can get a few days in a row, I do feel just like on average a little calmer, a little less stressed.
That's cool.
And so there's exhalation going on there. We talked about this briefly in a previous episode. There's a lot of interoception.
You got it.
Just a lot of mindfulness, kind of inward focus. Yep.
Absolutely. That goes on the list too.
But to your kind of, I want to underscore what you said at the very beginning, and that's that you have to assess and reassess.
You do.
Because everybody's different. And so, I think what I see now, it's funny now that I've been working with you, I see way more neuro stuff in my algorithms.
Yeah.
And so there's people, who are like, do this to stimulate the vagus nerve or whatever.
Yep.
And it's a lot of it's really good stuff. But to your point, it's like, this might work for you, but it might not, and if you're not testing, then you're just kind of going blindly into it. Right.
So social media, things like that you're seeing, my stuff included, because like someone who doesn't understand what I'm teaching is going to put me in the same category. It looks like we're treating the body like a switchboard, with on and off switches. And that's not, at least the work that we're doing. It's not that. Anyone who's taken our courses, I mean, they come in wondering if it's that, and they leave going, oh my gosh, that was awesome. And now I understand that it's not just about doing a quick activation drill, So yeah, the thing with the vagus nerve is if you're going to change state and do it in a way that is beneficial and provides long-term results, if you need that, not everybody needs that, you have to create autonomic changes through your drilling. and it takes more time to do that. So just humming is probably not going to do that as much as a 20-minute breathing routine combined with, some breath work, combined with strength training, combined with an insular belt, as we call it, around the abdomen, which is pressure on the abdomen, with Tiger Balm in your ears. You know what I mean? Like that's why you have to know different ways to stimulate the vagus nerve and possibly figure out different stacks that you can put together to get more of a stronger stimulus.
Yeah. We talked about your experiments with binaural beats a long time ago. And to recap for the listeners, you basically said it kind of like it shifted your parasympathetics too much. And
overdosed
for like a couple
me,
days,
for sure.
You were kind of like in a...
Yeah, I was in a daze. It was like feeling hungover.
Yeah. So I just think that's interesting. I haven't personally experienced that, but it's kind of like the opposite extreme. It's like there's levels to this. Like you could feel a little better humming right now, but like to actually get a shift, like there might be more work involved, or the right stimulus might need to be introduced. All right. So I've got a couple questions that I'm going to lump together.
Yeah.
One of them is from the real Lucio 13, or maybe Lucio. Is there anything you have for chronic headaches? And the other one is from Tarini 1, who says, can this help people with migraines?
Mm-hmm. Yeah. So the answer is yes. You can use applied neurology to possibly improve, reduce, possibly even resolve headaches. It may not be headaches are. So first of all, this is not something that people generally come to me for, right? I'm not the headache guy, but sometimes what happens is I'll work with somebody and I will find out later on when they start to get kind of deep into the work we're doing. They're like, oh, I should tell this guy all sorts of stuff because he's probably got weird drills for me that could help. So it's like, a few weeks into the work, maybe even more, maybe it's a year. I don't know. Someone might go, hey, so what can I do for migraines? Because they start to pick up on the fact like, well, you seem like you got a tool for everything.
Yeah.
And so, yeah, you can use this for migraines. There's there are lots of factors to why somebody might have a migraine, but I'll talk very generally and kind of give people an idea. If you're going to affect migraines, headaches, whatever, you want to be thinking about the trigeminal nerve for one. And we have an episode on the trigeminal nerve.
That's right.
Whole episode. Yeah. This is starting to flow, right? We're starting to have, we can back this stuff up with other episodes, which is great. So I have a whole episode, I believe, called Training the Trigeminal Nerve. And so I talk, in that episode, we go over the specific neuroanatomy. I think headaches and migraines come up in that a little bit. And you want to be thinking about the trigeminal nerve and things that you can do for it because it's largely involved in the experience of a migraine. So the short answer is yes. Sometimes you can also use applied neuro to down-regulate, or the language that we use is inhibit other forms of sensory input that could be kind of overloading a person during like the buildup of what turns into a migraine. So I've seen people have success with like wearing earplugs or sunglasses or both at the same time, or even colored lenses. And this actually, there's some research on the color green being useful for people who suffer from migraines. And so you could buy a pair of $12 plastic green lenses on Amazon and see if it helps you when you're starting to feel the onset of a migraine. Because for some people it does. Green can be quite calming and has some kind of inhibition effects on the brain. It's worth a try because it's not expensive and you got to test it, right? You just got to test how the glasses are affecting you. Typically we would test range of motion, and then if it improves your range of motion, and usually when people find the right color, it gives them a sense of something good, whether it's, hey, I feel calmer, or I feel more grounded. People will tell you, I just don't want to take these off. I like this color. And if that is happening, plus your movement is improving, that's a good sign. And then you could possibly see if the green ones help you for sure. As far as trigeminal nerve goes and doing things that affect it, well, we've got different things we can do sensory-wise on the face. So there are companies that produce vibration devices that are designed for like the face and the palate and the teeth, because all of those areas from a sensory perspective are supplied by trigeminal nerve. So we can do sensory on the face, on the cranium, and possibly get some relief. There's other exercises you can do with your jaw. I've got some of those. I actually have a good piece on TMJ exercises on YouTube. And so in that video, I'm pretty sure I teach several different jaw mobility exercises, including a very powerful exercise called a trigeminal nerve glide. So that basically gently tensions the trigeminal nerve. Now, again, none of this stuff is like foolproof. Like you got to test it and see, does this help me? Like, how is my brain perceiving this? But most people that suffer from headaches usually have jaw issues or neck issues. And so learning how to mobilize your neck and your jaw and move it through a full range of motion without building unwanted tension can go a long way. So can vision exercises.
I was about to ask about that. Yep.
Yeah, you had that in your mind because you probably remember we talked about this in the trigeminal episode. There are specific vision exercises you can do. Now, this is a little bit of a slippery slope because some people have visually induced headaches or migraines,
right,
where your visual system is fatiguing out. And then that is kind of the catalyst for the muscle tension that then starts to build in the neck or the jaw. And, you start to feel it manifest into a headache. So it's a little bit of for some people have to be cautious there. If you have vision problems, it could be easy to overdose yourself by accident. So you gotta know that.
Assess, reassess.
Yeah, assess, reassess. But for other people, there are specific vision exercises that might do the opposite. All right, it might actually decrease threat and tension and help people with headaches. And some of the convergence type skills, and we talk about this in that trigeminal episode, pencil push-ups, things like that, can actually be useful for affecting trigeminal nerve. And that can be a useful tool for dealing with headaches and stuff. I mean, there's tons of stuff because when you look at a headache, for some people, it's a global response of the nervous system to threat. So that essentially means now I can reach into my toolbox and possibly use any tool to decrease threat. Right. And so that's why it's not like a protocol thing. It's not like, okay, ABC.
Right.
You really have to approach it in different ways. And of course, there could be nutritional layers to this.
Even hydration,
Hydration and, hormonal and just all forms of stress. If in fact you're having more of a threat bucket output headache, right? If your visual system, if it's visually induced headaches, well, now you have to figure out a way how to improve the stamina of your visual system without overdosing yourself and giving yourself the symptoms, right? And so that's a process, right? Again, back to assess, reassess. But yeah, got to think about trigeminal nerve, some of those local exercises, sensory on the face. And man, if anyone tries the green glasses and has success, let us know because that would be cool.
I tried to order the green ones and they sent me blue instead.
Oh, really?
So I kept it because I didn't have blue yet. But
yeah.
I was like, man, you reminded me just now. I really want to try green.
Yep.
But yeah, that was fun. I got like green, red. I've got the orange blue light blockers ones. And then I have the black ones that don't have lenses. They just have like bars that go across.
Oh, interesting. Not pinholes, but bars.
Oh, no. I have pinholes.
Pinholes. Okay. So they got the little holes.
Yeah. So
those
like
can actually
almost.
Those could actually be useful for migraine sufferers in some cases too. It decreases light information coming in through the eyes and can actually affect the midbrain, which is where like sympathetics are. So yeah, that's another type of like an inhibition tool that we have a lot of success with. So that's another one to try.
Very cool. All right. This one is from Yuli HRDK. I don't know how to pronounce
Yeah, I know. The handles are tough, man. Yeah.
Like a lot of times it's like an abbreviation of a full like last name. But it's like, I don't know what the vowels are supposed to be, man. So this one is blood pressure drills, please.
Oh, okay.
And yeah, I was just curious because I don't think we've ever really talked about blood pressure. At all. And so I'm just kind of curious, is that something that you think about affecting or that you've seen be affected using applied neurology?
Yeah. So you can affect blood pressure, right? Because blood pressure is an output, right? So anytime we can call something an output, it means we have the ability to change input to change output. So you can absolutely approach blood pressure with this kind of neuromaterial. In fact, we use blood pressure as one of our advanced assessments for just looking at people's autonomics, and it helps us understand the brainstem better, because you have a right brainstem and a left brainstem that are both involved in autonomic balance and blood pressure. So we actually we teach our students to use taking a person's blood pressure on both sides.
Oh, that's right.
Yeah, to get a sense of, okay, is there a difference side to side? And typically what we talk about is that a difference of let's just call it like 10 points, right? On one side generally points at issues that could be happening on that side of the brainstem. So brainstem, think about it as just the brainstem's not doing its job appropriately. And so it is not regulating blood pressure appropriately. And so you kind of have this lopsided blood pressure, higher on one side than the other side. So you can have more of like a neurologically generated difference side to side in blood pressure, which is important for people to know because most people don't know that. And the thing is, when you go to the doctor or you go to the dentist or you go to somebody who's going to take your blood pressure, they take it on one side. I've never had my blood pressure taken on both sides. I have my blood pressure taken on whichever side the person is closest to me on. It's usually my right. Right. So this is important. I don't want to go too deep down this rabbit hole, but like you can have very large swings in blood pressure and it's more neurologically generated on one side of the body. And it's important to know that because it's likely that a lot of people don't have to be medicated, or at least medicated as long as they, have been or whatever, if they only have a neurologically kind of generated blood pressure. Now it's also, there's like some red flags involved with that too. Like sometimes you can have like such a higher blood pressure on one side that you'd be wanting to bring that to the attention of a physician, because that can mean some different things, like actual blockages and stuff. I've never seen that myself, but it's a thing. We're talking more about like hey, I'm 10 points higher on the right than I am the left. And that is more indicative of what we would call a PMRF issue on the right side. So it's the higher side. So in the work that I do, I am often using blood pressure as a reassessment because I'm trying to bring balance back to a person through the right activation or inhibition drills. And one of the changes in output that we can see rather quickly in session is blood pressure becoming more balanced on side to side, which indicates that we are approaching a person's cortical or PMRF issues well. And it's nice because it's a direct assessment on autonomics. It's not just a movement assessment anymore. It's now we're looking at actual autonomics and getting some data on that. So it's useful. So anyways, if we're talking about that type of blood pressure versus like a bilaterally high blood pressure, more like cardiovascularly generated, it's very different. In that sense, there's actually great research that has come out on this, indicating that of all things, wall sits And hand grip exercises have been incredibly useful in the literature and different studies for helping people reduce blood pressure. And it's pretty easy to look up. I think it's pretty out there. It's several minutes at a time of wall sits. But if I remember correctly, what I read was that both the wall sits and the hand grip exercises, like the strength, like hand gripping, you're using your muscles, were actually more effective than aerobic exercise. And
wild.
Yeah, and the sets were shorter. Like it was like versus aerobic exercise for, I don't know, 20, 30 minutes or something. I don't remember the details, but easy to find, I think. And it's just very fascinating, right? So the muscular effort. So those are two things to look into, because if you could just add some wall sits to your routine or whatever, or some hand grip exercises, and see that helps you with blood pressure, well, that's great. Breathing exercises will also have research behind them to be effective. I think, again, it kind of depends on the person. You got to test the style of breathing, and if the person has dysfunctional breathing patterns, that might be a different thing, and some things need to improve before they might see the result. But again, generally speaking, it has been shown that more of the reduced style breathing that has more of an exhalation focus has been quite useful. And you have to build up time with this. This is not like 30 seconds of a breathing exercise. This is, you're building up a practice. You're building up a breathing practice that, can help you. So those are great things to look into. And then for more of like the PMRF, or neurologically generated high blood pressure, where it's like on one side, there are so many options at that point, because we can target the dysfunctional PMRF side with so many different kinds of inputs. So it could be vision exercises, it could be vestibular exercises, it could be movement drills, but on the opposite side of the body is a good place to start. So if I had, so my presentation early on when I got into all this work was I had a PMRF pattern on my right side, and my blood pressure was roughly 10 or 12 points higher on my right all the time. And I started doing a lot of left-sided movement. So training the left cerebellum will also train the right cortex and the right PMRF. And so I would do a whole mobility practice with the left side of my body. Probably about 70, maybe 80% of the practice was all left-sided. And I started seeing lots of shifts, changes in my pain levels, but then also changes in my blood pressure becoming more balanced. So those are all good things to realize. It comes down to assess, reassess, and you can know that you can actually, and this should be very empowering for somebody that is trying to find exercises that are affecting their blood pressure. You can test your blood pressure as the assessment. You don't have to rely on anyone else. It's just see how it affects you, and you can get some really good clues.
I think especially for some people, it takes a while to, just trust how do I feel, or to trust, like, is this range of motion actually different, or you know what I mean? Like it might take some time to kind of build that fluency, or that confidence in self-assessing. So with blood pressure, you get a number.
You get some numbers. That's right. Yeah. You get some numbers. That can be really helpful.
This is kind of a nice segue. This is from Mind and Motion Perform, and it gets cut off, unfortunately. Mind and Motion Performance, I'll just say. Cerebellar exercises. I've got quite a few patients with one-sided weakness. And I will also say, just off the bat, we have an entire episode on this. Called Complex Movement Training, or Training Your Cerebellum. So we probably don't need to go into a lot of detail, but I just thought I'd bring it up since you mentioned cerebellar training in the last question.
Yeah, and that's the key, right? Is complex movement training. Because in order to engage the cerebellum in training, we have to really challenge it with novelty and complexity. So we talk about all that stuff in the episode. When the person asked a question, they used the word weakness. And I just want to be clear that when we're talking about the cerebellum, if we were to say weakness, which is totally fine, we might be, I'm wondering if they are actually referring to weakness as difficulty with coordination and accuracy and rhythm, because that's typically the type of movement deficit that we would correlate to the cerebellum. Mm-hmm. So challenges with motor control versus challenges with strength.
Right. Oh, my left arm's weaker than my right arm.
Yeah. Now you can certainly have strength changes because the cerebellum is also involved in calibrating muscle tone, particularly extensor muscle tone, pretty proximally too. So there's that. You could, if you have a cerebellar deficit, you might actually experience weakness in some of your extensor muscles. Could be in the spine, could be in the shoulders, could be in the hips. Okay. You could have a one-sided cerebellar deficit that turns out as kind of presents as weakness. But so I'm assuming that when they say weakness, it's like the deficit side in terms of motor control, right? So if that's the case, and this will depend on the person in front of you, and again, you always have to assess, reassess. The only way to know how the cerebellum is responding to a drill is to test the cerebellum before and after. So that means after every single cerebellar drill set, we have to have an immediate reassess. And that could be, like, our students know this so well at this point, that has to be some form of coordination assessment. And we have a whole cerebellar flow of assessments that we use. And there's lots of different kinds. One of them is in balance assessments. One of them is like a Romberg's style balance assessment, where you're having the person close their eyes and you're looking for postural sway and seeing how they respond to being in different stances with their eyes closed. So have an assessment is the first most important thing, and then reassess after each input to figure out whether or not the cerebellum is improving. And there's different reasons to explore different body areas. Now, here's the first kind of low-hanging fruit. If you have, let's say, a left cerebellar deficit, so the coordination issues are on the left side of the body, you're going to approach that ipsilaterally. This is at least the first way of thinking that is very high percentage. So that means I would do coordination exercises on the left. If the deficit was on the right side of the body, I would do coordination exercises on the right. Pretty easy to remember that. And now I have to challenge the person appropriately, challenging their balance, their coordination, their accuracy, their rhythm. So we love joint mobility exercises, teaching people how to move through full ranges of motion with good motor control. Those are very strong cerebellar activations. You can also use different accuracy type drills where the person actually has to target something. So one of the common clinical assessments is called a finger-nose assessment, where the clinician stands in front of the patient or client, and the client touches their nose and then touches the coach's finger, touches their nose, touches their finger, and they're going back and forth between the 2 points, trying to be as accurate as possible. But the clinician or coach is moving the target around a little bit. And so you're getting a sense for how smooth is the movement path that they're using with their limb. You can even do this with the lower body, and we call it toe targeting. That's one thing to be looking at. And then you also look at what happens in essentially the last 2 inches, the space between the person's finger and the target, because if there's a little hesitancy or sort of ratchetiness to the movement in those last 2 inches, that's called a terminal tremor, which indicates some cerebellar issues. And you got to know your functional zones of the cerebellum, because different body areas will correlate to different zones of the cerebellum. So there's different reasons why you might do exercises with the hands and the feet versus the elbows and shoulders or knees and hips. So we teach all this in our course. So the first thing is train it ipsilaterally. Know what you're trying to improve and retest after each input to see what's actually improving. Again, we like the joint mobility exercises a lot, or anything that requires you to target. Now realize targeting could also be punching focus mitts. It depends on the person in front of you. Do you want to do something athletic? Okay. Are we doing something a little bit more fine motor, I guess you might say, where you're turning something like that finger, nose, or toe targeting drill into the exercise for them. There's so many options. And then adding balance challenges to that stuff. Balancing in a tandem stance, balancing on one leg, balancing in a lunge. That really engages the midline cerebellum, okay, which is a zone that we're interested in training. So that's kind of like baseline for us. And then we go on to teach our students all about what we call the cerebellar continuum of activation, where we bring in different training variables to make the work more challenging. So that's like using resistance bands to those drills. That's also like using a metronome for timing. So doing some kind of movement, timing it to the metronome, trying to be precise. You get feedback when you are off rhythm, and then it allows you to correct. Because one of the keys, the cerebellum is very much involved in error correction. So it's okay, like mistakes are welcomed in the drills. And you want to build a drill for someone that allows them to get feedback that they've made a mistake, but then actually correct it. And that's where the magic really happens long term. It can't be too easy. It can't be too hard, right? You got to find kind of that middle ground where the mistakes are welcome, but you're winning. You're having more success than not. So I love all that stuff. And then putting it together, stacking it together. So doing a joint mobility drill attached to a band while timing it to a metronome. Awesome way to approach that stuff. And eyes in the inner ear matter here too. It's more complex, probably can't go into it in detail now, but any exercises for the eyes and the vestibular system have an impact on the cerebellum. So that may be part of the strategy too.
I would hazard there's some people who are just naturally great drummers.
Yeah.
Like they have coordination in all four limbs and they have great timing and they just innate sense of timing and coordination. And I wonder if they're like just like cerebellar athletes.
Totally. I've tested quite a few musicians with this neuro stuff, and they like smoke some of the tests, and you have to make it really, really hard. You've got to like have them close their eyes, balance in a one-legged stance while doing like the cerebellar drill, and like perturb them,
drink 2 shots of whiskey.
Yeah, and like it's just like seriously, it can be pretty amazing to see how much coordination they can have with these like fine motor type skills, and also for how long they can sustain it.
Mm-hmm.
So you just got to make it's all testing people is all relative to the person in front of you. Right. If someone's really showing me skill, then I just make stuff harder. And then eventually it teases out some of these deficits, even if they're pretty minor.
Because you want to find the threshold where it's just difficult enough that you would be able to track if something's improving or getting worse.
That's right.
Because if it's too far away from that threshold, you won't be able to tell if what you're doing is helping the cerebellum or not.
Yeah, exactly. And when you're working with the general population or an athletic population, this is why those types of people cannot go into a clinic and get help. Because as far as what's happening at the clinical level, they are amazing. But you can have low-grade issues with all of these systems that are affecting you, giving you, involved with your pain and involved with your balance, involved with your movement deficits. And so there's a huge gap between what is like more clinical neurology and maybe like, on the rehabilitation side versus, where I live in, working with the general population and athletes. And I'm still finding all that stuff within this population of people, but you have to approach it sometimes a little bit differently and make things a little bit harder. And it's interesting in that way.
Yeah, that's fascinating. Well, I think that's all we got for today.
All right, guys. I hope you enjoyed that Q&A. Give us some feedback. Let us know what you think, and keep your eyes peeled for upcoming weeks. What we've been doing, if you haven't seen it yet, is I'll post on Instagram. I will typically put up a post within our feed that says, "Hey, we're doing another Q&A episode with Tony," and if you have any questions, you can drop them in the comments. So we've been collecting some of the questions that way, and then I typically follow up with a question box within my stories too. So if you're if you're seeing the stories that I put on Instagram. Look for the podcast Q&A box that we'll use, and that's another way to submit them. And yeah, give us your feedback. Let us know how you're enjoying this style of episode. I think it's been a nice change, and I'm liking it. Let's see. What can I tell you? I can tell you to go watch my free Neuro Masterclass if you haven't seen that already. So you can find the link for that in the show notes. If you are kind of just getting into the podcast and getting into this material, that's a wonderful place to start, is with the free masterclass. So I'll take you through all the foundational kind of educational lessons that we like to teach people. And in addition to that, you'll get some, not only an more understanding for how the nervous system works, but things you can try, drills you can try. And in that particular masterclass, we dive deep into cranial nerves, which is pretty cool. And you'll walk away with some tools that you can use immediately to help improve movement and hopefully decrease pain. That's it for today, guys. Thanks so much for tuning in. We'll be back soon.